Dear viewers, welcome to another episode of our ultrasound training course. Today I am going to share a case of spina bifida. Here you can clearly see the spine of the fetus and you can see the double tram track appearance. And this double tram track appearance suddenly disappears at this spot, and here is the posterior osseous defect. Now when we will move, this is the area of the defect and it is covered by skin. Now when we will move downward, here you can see the posterior elements are again clearly visible, and so there is a defect in the upper lumbar level. Sorry. But there is no associated meningocele. Here I am again going to show the posterior osseous posterior osseous elements are clearly visible. This is the defect. And now coming to the transverse view, here you can see the posterior osseous elements are visible with a bright line. It is still visible, and now the defect is coming, and here is the defect. Here you can see there is no posterior osseous element, but the area is covered by skin. So it is a case of spina bifida occulta. Thanks for watching. Please
So now let's move toward the whiteboard. So I could explain the image I have shown you a little bit more. Here, this is the fetal head. You was able to see the fetal head on the ultrasound, and here is the spine. This is the spine. This was giving a clear-cut hyperechoic appearance on the ultrasound images, and this appearance is called double tram track appearance. You can see there are two lines. One line is below and one line is above. This is called double tram track appearance. And in the image where I showed you that there is a defect, this was the point from where the posterior elements were missing, almost upper lumbar level. And here an irregular shaped hyperechoic structure was present. This could be jumbled up bones, malformed bones, and this was the defect. So the double tram track appearance was disrupted at the point, and this was the point where the double tram track appearance was not clear. And further below, again the double tram track appearance was clear. Then coming to the transverse section, I showed you, for example, this is the point cross section of the spine. It was like this, it was again like this, it was again like this, but at one point there was a gap just like that, like this, and I pointed out it with my arrow marker. So here was the posterior element present, here was the posterior element present, but at this point the posterior element was absent, and this was the point where the spina bifida was present. Now coming to the varieties of the spina bifida. The spina bifida can be broadly divided into spina bifida occulta and spina bifida aperta. Spina bifida occulta is the case I have shown you. As you can see that this whole defect was covered by the skin. So when the whole defect is covered by the skin, it is called the spina bifida occulta. Usually it can easily be missed on antenatal ultrasound and on baby delivered. There is a bunch of hair at this point on the skin which gives a sign of spina bifida occulta. Now the other variety is spina bifida aperta. In this is the spina bifida cystica. Spina bifida cystica is the thing where the spinal contents are bulging outside this posterior osseous defect in the form of a cyst. It can be a meningocele where only meninges are bulging, or a meningomyelocele where both meninges and the spinal cord is bulging. So it is easy to diagnose spina bifida aperta, but the spina bifida occulta is really difficult to diagnose, and the only sign is the disruption of this double tram track which represents the posterior osseous elements. With this, I hope so that I am able to explain the image in detail. If you have any queries, any questions, you are most welcome to ask. I like to read your comments and respond to them. I'm Dr. Adil Riaz, consultant radiologist at Ilyas Medicare and Diagnostic Center. Thank you for watching. Please do like, comment, share and subscribe to my channel. Allah Hafiz.